tragic reality is you can't get a rape exam at every hospital.
The trauma of sex assault can last a lifetime. And in Maryland, survivors can be traumatized more than once as they work to get help and justice for the crime.
Yeah, but there are efforts to change that. 11 News anchor Deborah Weiner shares how arming yourself with information can be key.
There are steps being taken to make things easier on survivors who, by the time they get to the hospital, have already been through so much.
Right here, you will have our first examination room. Everything that we would need to conduct a medical forensic exam is located right here in this room.
An intentional layout and design for the Sexual Assault Forensic Exam, or SAFE program at GBMC. 11 News Investigates got an exclusive look inside at the suite hidden inside the hospital.
This unit actually isn't even marked on the outside, so we want to make sure our patients feel really safe.
The unit and program to help sex assault survivors at GBMC was started by Dr. Rudiger Breitnecker. Starting in the 1970s, he collected evidence from sex assault survivors and preserved it in hopes of helping them find justice in the future.
As Baltimore County over the time had identified a particular sample with a particular reported crime, we would subpoena that record and then investigate that crime.
The slides have already helped secure convictions in dozens of cases. And now the county is processing the remaining slides in hopes of closing more cases. There's also a focus on making the process of getting help after an attack less traumatic.
It's really not a kind process right now. We've got to improve it.
Lisa Jordan is the executive director of the Maryland Coalition Against Sexual Assault. She says survivors are forced to make critical decisions immediately after they're attacked.
The tragic reality is you can't get a rape exam at every hospital.
You can be treated for injuries at any hospital. However, you cannot get a forensic exam or rape kit at every hospital. For those, you need to go to one with a forensic nurse.
And if you are raped, you are supposed to know somehow to go to a certain hospital that have the medical personnel with that expertise.
Baltimore County Senator Shelley Heddleman says expecting people to understand which hospitals can really help you is unrealistic.
Unfortunately, not enough people know, and obviously it's a traumatic experience if you're raped. And so you go to the closest hospital, if you go to a hospital at all.
According to the state, Maryland has 48 hospital emergency departments. Only half are staffed with forensic nurses, even fewer for patients 12 years old and younger.
We had a survivor the other day who had to go to several different hospitals to get the care that she needed.
The exams have to be conducted by specially trained nurses who collect and preserve evidence that can be used in court. And that evidence needs to be collected as quickly as possible.
Because everything that you do can potentially disrupt evidence that may be on your body. So we try to tell patients not to shower, not to eat, not to drink, anything that you can think of that would help to preserve that evidence.
Senator Heddleman is working to make access more available.
What we know is we have a very limited number of what they're called FNEs, right? Forensic nurse examiners in our state.
A bill waiting on Governor Wes Moore's desk calls for a study to look into telehealth options. The idea would be to allow nurses who do not have forensic training to legally get guidance from one who does at another hospital.
This would be a way to not only, keep the survivor from going from hospital to hospital, but also maybe expand where we could have the exam.
For those who need help, you can call the Maryland Coalition Against Sex Assault. That number is 833-364-0046. You can find resources from counseling to legal help and beyond. Again, that crucial number, 833-364-0046. In the newsroom, Deborah Weiner, WBAL TV 11 News.